Hi everyone, I'm Dr. Alejandro Castro. Welcome back to another episode of Vet Board's preparation series. If you are preparing for the NAVLE or the ECFVG, this episode is for you. We are learning through clinical cases and multiple choice questions, these things you need to know to pass your exams with confidence. And today we have a case that is one of those classic NAVLE traps. A case where picking the wrong medication can actually make things worse. So let's take a look. You have an adult Beagle with chronic liver disease, and this dog has just been diagnosed with idiopathic epilepsy. You need long-term seizure control, but not every anticonvulsant is safe for this patient. So here's today's NAVLE-style question. A 9-year-old Beagle with idiopathic epilepsy and chronic liver disease requires long-term anticonvulsant therapy. Which of the following is the best choice for seizure control in this patient? A. Phenobarbital, B. Potassium bromide, C. Diazepam, D. Primidone. So pause the video if you want to think about it and think about the answer you would choose if you were taking the exam. Okay, so the correct answer is B, potassium bromide. And here is why, and this is super important. The moment you add liver disease to the picture, your entire medication choice changes. Let's break this down the practical way. Potassium bromide is excreted and changed in the urine. It's not metabolized by the liver. It's safe when the liver is compromised. It bypasses the liver completely. And this is what your patient needs. Effective seizure control that doesn't stress the liver. So what about the other drugs? Phenobarbital, no. Is hepatically metabolized, raises liver enzymes, and can cause serious toxicity if the liver is already compromised. How about Primidone? Well, might be even worse. It gets metabolized into phenobarbital. So if phenobarbital is risky, Primidone is even riskier. Potassium bromide, it also competes with chloride. So if the dog has kidney disease or is on a high salt diet, you must monitor the levels closely to avoid bromide toxicosis. Oh, one more thing, what about diazepam? Well, diazepam is an emergency tool only. It's great for stopping a seizure, but it's terrible pretty much for long-term use because dogs develop tolerance fast. So again, potassium bromide is the safest long-term option in patients with liver disease. And just some quick reminders. You have to monitor if renal function is reduced or patient consumes a diet that is high in salt. And avoid phenobarbital and primidone in patients with liver disease. Don't make the liver work harder than it has to. Okay. So thanks for watching another episode of the Vet Board preparation series. Make sure you subscribe. We are breaking down these tricky cases every week. So I'll see you in the next episode.